Welcome to HealthWatch, presented by Novant Health. I'm Amy Myers, and today I will be your host. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will meet two physicians who have recently come to our area, Dr. Lori Tackman of Novant Health Pediatrics Brunswick and Dr. David Smith of Novant Health Oceanside Family Medicine in Bolivia. Then, we'll learn more about a common condition, heartburn, with Dr. Max Beninati. And finally, Michael Maurer of Novant Health Rehabilitation will join us to share more about physical therapy services. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Dr. Lori Tackman of Novant Health Pediatrics Brunswick. Dr. Tackman, thank you for joining us today. We're so excited to have you on the show and in the area. For our viewers who may not have met you yet, can you tell us a little bit about your education and your background?
Absolutely. I'm originally from Michigan. Grew up in Ann Arbor. Went to school, Central Michigan, went to medical school at Michigan State University. Did my residency at Indiana University for Hospital for Children, and lived there for a few years, and then moved to North Carolina.
Very nice, very nice. How long have you been in North Carolina?
Since 1999.
Nice, nice. So we call you a local to North Carolina.
Yeah, yeah.
And you recently relocated to Brunswick County, correct?
That's correct.
Wonderful. Well, what interested you in pediatrics to begin with early in your career? What made you pursue that?
So when I first started medical school, I thought I could do anything but pediatrics. I don't know about children. And then once I started getting into medical school and the clinical rotations, and I realized that children are the best patients ever. So that's what made me go into pediatrics.
What makes you say they're the best patients ever? I don't know that I always feel like my kids are the best patients ever, so I'm intrigued.
Yeah. So as a physician, I appreciate them being my patient because, well, number one, they heal so quickly. They appreciate, you know, the treatment. It seems like so quickly, and they're just a pleasure to take care of, and they bounce back so fast.
That is so true. I tell myself, even when my little guy, you know, falls or something like that, it's like, it'll be healed by next weekend. Don't panic. You know, what takes us a month or 2 months to heal from.
Absolutely.
Children are so quick to just get right back.
That's right. Yes, it's so rewarding when they come in to see you and they're looking absolutely terrible and on death's doorstep, and you take care of their fever, and then you come back an hour later and they're bouncing on the bed. So that makes you feel so much better.
Yeah, so very true. So very true. And most recently, now, were you were a pediatric hospitalist? Is that correct?
Yeah, I was sort of a newborn specialist,
okay,
and just rounded at the hospital on the newborns and did procedures in the hospital. So yeah, that's what.
So what interested you, you know, in this moving here and taking a role in a pediatric office, making that switch?
Yeah, well, I've vacationed here numerous times, and I thought, well, I absolutely would love to live there. And I did miss building relationships with families. When you're just in the hospital, you just see them for, you know, one period of time, and then you don't really see them afterwards unless they have another baby. So I really miss building the relationships with families and getting to know the patients and follow them as they grow. And I thought this was the perfect opportunity.
Yeah. And here, will you actually see patients or newborns in the hospital as well as seeing kids in the office?
Absolutely. We're going to start going in and seeing the newborns. and do procedures in the hospital as well, circumcisions or frenotomies as needed, and then for follow-up, full comprehensive pediatric care.
Nice.
Yes.
So kind of the best of both worlds, and you get to live at the beach, which
Yes.
isn't so
Yes.
bad either. Well, tell us a little bit more about Novant Health Pediatrics Brunswick. I know we met your partner a couple months ago at the office there, but let's start with the basics. Where are you located?
So we are in the Brunswick Medical Campus. Yep, right off of Highway 17 and 211. And we're in Suite 205, the second floor there in that building.
Nice.
And you're Monday through Friday, 8 to 4:30.
Wonderful.
So
Great location, kind of right in the middle of the county, so convenient. And you do have another partner, right? So
Yep.
2 pediatricians in the office?
Yep, yep,
Very
Dr.
nice.
Kaylin Edwards. Yep.
Nice, very good. What about services you offer? I mean, probably we'd expect the basics, but
Yep.
What can you tell me about the range
Yep.
of services?
So, yeah, we do comprehensive pediatric care, well child checks, of course, sick visits, anything that can happen to a child, we'll go ahead and see them.
That's right.
And we, as I mentioned before, we will do the circumcisions and frenotomies in the hospital, but we can also do them in our office. And we're also going to be offering ear piercing.
Very cool. I thought I heard that. What a cool thing. So
Yeah.
safe ear piercing, right?
Yep.
Seems like a
absolutely.
great thing.
Yeah,
My girls do
yeah.
not have their ears pierced yet.
Yeah,
And the idea
yeah.
of being in a safe clinical setting.
Yep, and we have some very cute earrings, so come on by.
Very nice. That's cool. So what ages exactly? I know you start newborns
Yeah, newborn through college.
through college age.
Yep,
Okay,
yep.
great. Well, this is wonderful. We're so excited, to have you here. We're leading into the holidays. Any tips? I feel like everyone worries about the germs around the holidays, family gatherings.
Yes. So first of all, great hand washing wherever you go, and don't forget your flu shot. Yep.
Is it too late?
Nope, never too late.
Never
Yep,
too late.
yep.
What months do you typically recommend?
Well, you can get them anytime, starting in September and really through, the winter.
Okay. It does. Each year it seems like the flu season hits at a little different time.
Yep.
Makes sense. Okay. And you offer the flu shots in your
Yes.
office.
Yes, we do.
Great. All right. Was there anything else you'd like to share with us as we wrap up here?
No, we're just excited to be here, excited to be the new pediatricians in town, and we're accepting new patients, obviously, and we look forward to building lots of good family relationships.
Nice.
in
And
the
I believe
community.
you offer, people can call the office to make an
Yes,
appointment
yes.
or schedule online as well. Is
Yes.
that right?
Yep, that's true.
Okay.
Yep, you can, if you have a MyChart account, you can go in and schedule through that, and also through the Novant Health Find a Doctor website, and you can find us and schedule your appointment.
Perfect. That's great. That's great. Well, we appreciate you coming on the show so much.
thanks for having
and
me.
are so excited you're here in the area.
Thank you.
Now, let's welcome Dr. David Smits of Novant Health Oceanside Family Medicine in Bolivia. Welcome, Dr. Smits. We're so glad to have you in the area. For our viewers who may not have had the chance to meet you yet, can you tell us a little bit about your background and your education?
Sure. I'm originally from the Chicagoland area, where I received a bachelor's in science from Elmhurst College. Did a little tour of the pharmaceutical industry as a lab tech and decided I didn't really fulfill my working goals yet, so I went back and got a master's degree in biomedical science from Midwestern University, where I ultimately stayed and was accepted into the Chicago College of Osteopathic Medicine, where I received my medical degree.
Nice, nice. So kind of a neat path there. Hit a lot
It
of
was,
locations.
yes.
Very good, very good. And where did you work prior to coming here to Brunswick County?
Before coming to Brunswick County, I worked at Franciscan Health Hospital in Olympia Fields, which is a southern suburb of the Chicagoland area.
Okay, nice, nice. So what interested you in this area?
Well, oddly enough, I'd had a family member move down here about a year and a half ago, and then last August, I think, I came down to visit, and it was just a great area, but at the time I wasn't really looking to relocate. The position I was in started to change a little with the company, and so my contract was coming to an end, and I decided, maybe it's time to make a
Just a
grand
great time
move.
to
Yeah.
make a change.
And so I applied through the online recruiting site, and Joan got back to me real quick, and everything snowballed from there, but it's been a great transition.
Very nice. Well, we're so glad to have you here. And you're located right there at Novant Health Oceanside Family Medicine beside the hospital
Right
in Bolivia.
beside the hospital, yes. I'll actually be taking over for Dr. Kenneth Hanby, who left.
Okay, yeah.
And so I'll be working with Jason and
Lori, right? It's Jason and Lori that
Jason
are
and Lori were
there.
the PAs that are doing just an excellent job during this transition process, taking care of all the patients' needs. So,
Very good, very good. Yeah, that's a great office and a
Right.
good location.
Yes.
Convenient.
Well, right next to
and-
the hospital. Yep.
Absolutely.
All the staff I need.
Perfect, perfect. Well, I know, looking over some of your background, I saw that you've done some volunteer work, I think with Special Olympics and some big golf events.
Yeah.
Super curious about that.
So, so up north we have this thing called winter, where it gets really, really cold.
Yeah, we don't really have that
No,
here.
well, that's part of why I also chose the area to come to. But in the middle of winter, different organizations put on an event called the Polar Plunge, where they actually go out, break out the ice off of frozen lakes, and then crazy people dress up in costumes go out, jump into the freezing lake, and have donations raised to help support Special Olympics throughout the coming year. So that's really great, and I've done that for the past 3 to 4 years up there.
Nice.
Equally though, in 2015, I was able to be part of the medical staff on the course for the U.S. Amateur Golf Championship, and then in 2017, I was part of the KPMG Golf,
That's right.
Women's Golf National Championship at Olympia Fields Country Club.
So you were helping as a physician at those
Yep,
events,
I was a
correct? So kind of
physician on the field helping players, visitors, everything like that. Yep.
Very nice, very nice. Well, that sounds like some cool opportunities.
It was
and
great.
a cold
Oh,
one as
yes,
well.
yeah, a very cold one, but just super exciting and interesting to be part of all that stuff.
Yeah. You mentioned early on that you're a doctor of osteopathy.
Right.
So I think a lot of people may not be as familiar with what a DO means.
Right.
Can you talk a little bit about
Sure.
that?
Just like Dr. Hamby, I'm a DO, so we went to an osteopathic medical college, which receives the absolute same base education and planning and treatment of disease states as our counterparts in the MD world, except we're also trained for an extra 250 hours on what is known as osteopathic medicine, which helps focus on combining the disease state of the person, mind, body, spirit, and disease state so that we can take care of the whole individual and all their needs. But it also incorporates a certain amount of what's known as manipulative medicine, where we can put our hands on the patients in different areas to see if there's extra irritation that correlates to different organic disease functions, as well as structural function of the spine, joints, and muscle tissues from different types of sprains or irritations, and help utilize treatment options other than medication
So
to
a
help
little
reassess
kind of a
that.
holistic.
Absolutely.
Very nice, very nice. Well, at the clinic there by the hospital, is there a certain age range you treat?
No.
No.
Everybody.
Everybody.
I mean, I don't want to put my pediatrician counterparts out of business, but sure, anywhere usually from the ages of 6 to 106.
Okay.
But at
okay.
107, we draw the line.
That's no more.
No, really, we're very comfortable treating all age ranges, and there's an extensive panel there right now, so.
Great.
Yeah.
Great. So care for the whole family.
Absolutely.
Perfect. And if folks are interested in learning more, just call the office, correct? Or
Absolutely.
schedule online.
Absolutely. If you're with Epic or MyChart, very easy to either call the office,
Or just
schedule an appointment, or jump online, type it in. Yep.
All right. Sounds good. Well, thank you so much for joining us. We're thrilled to have you in the area.
My pleasure.
Now let's welcome Dr. Max Beninati of Novant Health Surgical Associates. Dr. Beninati, we're thrilled to have you back on the show, and
thank
you've
you.
been with us a few times. For those who may not have met you yet, can you tell us a little bit about your background and your education?
Certainly. So I went to Grove City College in Western Pennsylvania, went a little bit more north for medical school in Erie, headed to Annapolis, Maryland for fellowship, and made my way down here afterwards.
Very good, very good. And how long have you been here at Novant Health Surgical Associates?
Over 4 years now.
Nice,
So yep, my
very
family and I
good.
moved down, love the area, love the people.
Good, good. Time's flying, that's for
Absolutely.
sure. Let's start with a little bit about the clinic. Can you tell us a little bit, like where you have several locations,
Right.
and you have a few partners, correct?
Yes, yep. So I joined, there were originally 4 of us, now there are 5. So Dr. Tillotson, Dr. DeSandre, Dr. Scallion, Dr. Smith came on board, and then myself. We're even getting a PA soon.
Oh, great.
Yes.
That's awesome. That's awesome. And how many locations do you have now?
We go to, well, I personally go to Leland, Bolivia, and Southport offices,
Okay.
but we also cover Calabash.
Nice, nice. So you're kind of covering the whole county
Yes.
and have really grown into a large group.
Oh,
I can
yeah.
definitely remember when it was just 2 providers in the beginning.
Yep.
So much growth. You know, we hear general surgeon and we often think, what does that really mean? What types of services do you provide, or what types of surgeries, I guess?
Right, and I get that question from patients too, because people don't really know, and then they usually just show up because they don't know, and then we're happy to take care of basically everything. So anywhere from breast disease to vascular disease, colon, gallbladder, appendix, and personally I'm doing a lot of anti-reflux procedures. So there's a gamut of open, laparoscopic, and robotic surgery that we offer.
Nice. So truly, it's almost everything, it sounds like, when it comes to surgery.
No orthopedics.
Except for
We
orthopedics.
have
Great.
other excellent partners doing that.
Yeah, perfect, perfect. Well, you mentioned heartburn or GERD. Really would love to focus today on that. We've had you on a few times, and I think that's a health topic that people ask about a lot. So let's start with the basics. I hear the term GERD. I don't know that I really know what that is.
Right, so GERD is just abbreviation, stands for gastroesophageal reflux disease. There are even people out there who have something more referred to as LERD or LPR, which is laryngeal pharyngeal reflux disease, which is more of the upper symptoms as opposed to gastric symptoms. But that's a gamut of basically acid reflux, heartburn, most people know it as.
Okay, okay. So what are the signs and symptoms? Heartburn?
Right, heartburn, so that burning feeling behind the sternum of the chest. There can be a sour taste in the mouth, called water brash. So those are the common symptoms that people manifest
What
with.
did you call the?
Water brash.
Interesting, interesting. So it's like a sour,
Yeah,
just a
yeah,
strange
like
taste.
refluxate and fluid, or sometimes food regurgitates up to the back of the mouth, and they can almost feel it back there.
So is that kind of how patients usually present? They've been dealing with that for a long time, and they're concerned about they probably just want it to end, right?
Right,
Tired
right.
of that.
It's really a major inhibitor of the quality of life.
Okay, okay. So how would someone be diagnosed? Because honestly, if we ask most people if they have heartburn once in a while, they'd probably say yes, right? So how do you diagnose that it's an official issue?
Right. So most of the time, people make it to their family practice physician first, and that's kind of the front line of how we're dealing with this disease process. There's the people go through their day, they may have reflux, they may wake up with it because they were laying flat and feel these symptoms. Their family physician starts them on medication, and that sort of initiates that process of being diagnosed.
Gotcha. So the medication first, they try that for a while, and it maybe doesn't really make much of a change.
Right.
And then they find their way to you typically after that point?
Yeah, it's sort of a mixture. There are some people respond really well to the medication, and those are typically not the people that make it to the surgery team. The people who are not responding well, or who have switched medications multiple times, and there's several categories of medications, but they go through the medications, they switch, they change, they increase the dose, and then people start asking what's going on, are we missing something, and then the next step would be potentially getting an upper endoscopy, the EGD we call it, to look for hiatal hernias and sphincter tones of the lower esophageal sphincter, any cause for gastroesophageal reflux disease.
Okay, so that's kind of the next step then, is that upper endoscopy to really see what's going on if the problem persists.
Right, yep.
And is that typically done at our endoscopy center, at the Novant Health Brunswick Endoscopy Center?
Yeah, the majority of people I'd say are probably done there. We also offer
in
the
the
service
hospital.
at the hospital as well.
Okay,
Yep.
very good, very good. And that really still is that's part of the diagnosis phase.
Right.
So once it really is diagnosed and you need surgery, what does the surgery look like?
So when people come to me, it turns into a pretty elaborate conversation, and like you were saying before, so many people have this disease process and are affected by it with the quality of life. In fact, about a third of Americans have it.
Wow.
Probably only 10 to 15% of those people actually need an operation though.
Okay.
When we do an operation, I'm doing them typically robotically, and the steps to the procedure would be, if there's a hiatal hernia, return the stomach back into the abdomen, fix the hernia. And then there's that valve I mentioned earlier. A big part of the surgery is reinforcing that valve with the patient's native tissue, basically wrapping the stomach around the top of it.
Wow.
There's a fancy word, fundoplication, and I say that to my patients multiple times so that they try to understand, that's the big fancy word, just meaning reinforcing the valve there.
Understood. Okay. And you said you used the robot, so that's the Da Vinci robot.
Correct.
And more of a minimally invasive way of doing the procedure, is that right?
Yes, just a few little incisions. The majority of my patients go home after one night hospital stay.
Okay. What's the recovery look like?
Usually, to be honest, a lot of people don't have a ton of pain. We help manage that, of course, if they do with medication. It's around 2 weeks or so of feeling a little bit lack of energy and working up your strength. Most of my patients, I have a pretty clear-cut dietary and diet restrictions and handouts for the patients that come in, so we talk about that information too.
And typically the outcome after the surgery, most patients, they don't need medicine anymore, or
Right.
okay.
Yeah, so after 4 weeks, I take people off of their antacid medication completely. That is kind of a soft indication for me if people just want to be off of their medications, because there are side effects and costs to medication.
Right.
So at 4 weeks, I take them off their medication, and for the most part, people are just really feeling great, having a return of that quality of life that they missed for a while.
So specifically around this, I mean, it's such an interesting topic, and like I said, it affects so many people. If there are people at home who maybe have been dealing with this for a long time, it sounds like if they haven't seen their family doctor, they should probably do that.
Right.
But what if they've kind of been on the path for a while?
Right.
What would you recommend from there?
So if there's been a chronic reflux symptoms and heartburn and medication, that's definitely an indication to get an upper endoscopy. Uncontrolled reflux, although for the most part is more impacts the quality of life, can also lead to precancerous changes, and that can be screened with an upper endoscopy and biopsies. So I'm able to offer that, and as well as some of my partners. And they can either call my office directly, or if they're established with a family doctor and want the referral that way, they can do that as well.
Okay, perfect. So they can call directly if they like, or
Yes.
work with their family doctor. Either way, get that upper endoscopy and really find out what is going on.
Right.
This is great. Thank you so much. Is there anything else you want to add for our viewers at home?
I think just to so that they know that we're available to the county, and this isn't one of those issues that presents itself like an appendicitis, so where it's just an immediate, I have a problem, surgery fixes it, and get better. Usually it's this chronic kind of undulating symptoms, and people struggle and put up with it for so long, and they don't have to.
They don't
So
really need to do
yeah,
that.
there's a lot of options in terms of medicine and surgery, and I'm happy to talk about both options with them.
That's awesome. Well, thank you so much for joining
for
us
having me.
again today. We appreciate you taking the time to be here.
Absolutely, thank you.
Finally, let's welcome Michael Maurer of Novant Health Rehabilitation Services. Mike, we are so glad to have you on the show. For those who haven't had the chance to meet you yet, will you share a little bit about your background and your education?
Certainly, yeah. So I have a doctorate of physical therapy from Youngstown State University, which is in Northeast Ohio. Before that, I was at Slippery Rock University in Western Pennsylvania. I moved down here about 5 years ago.
That's awesome. A lot of education to get to a doctorate.
Yeah, so physical therapy at this point is a doctoring profession, so it was a big push by the American Physical Therapy Association to make that a 7-year degree, so a lot of schooling.
Yeah, plenty of school behind you. And now you've been out working as a physical therapist for several years, right?
Yeah, it's going on like 6 years now. I've been primarily in outpatient orthopedics.
Okay.
When I began working for Novant in June, I started actually working at the hospital too, so it was a nice little change, kind of mixing things up.
Gotcha. And you're with Novant Health Rehabilitation Services, right?
Correct, yes.
Tell us a little bit about that role.
So right now I am one of 2 physical therapists that work out of the Main Street office in Charlotte. We also have 2 physical therapy assistants there, and so while we're there, we're doing evaluations and then co-treating with the PTAs to kind of get our patients better.
Okay, great. So Novant Health offers in-hospital as well as outpatient services.
Correct. Yeah. So in the hospital, it's a lot more, being a part of the, care team, which kind of makes up the patient, case management, PT, OT, physician, nursing, kind of work together with them to really figure out, what's the next step for our patients? How do we make them better? How do we provide exceptional care to those patients?
Nice.
And then, in the outpatient clinic, it's a lot more about just, really narrowing down and finding, what's going on and, getting those patients back to their prior level of function.
Gotcha. In the hospital, I think of it as a PT, always the person making you get out of the bed and walk down the halls,
yeah,
right?
And that's where, so on the superficial level, it definitely looks like we're just getting patients up, but, sometimes you get those patients, particularly the ones in the critical care unit, that really, need some of that clinical expertise on, what's the best way to move them, how do we do it, where do we go from here, that sort of thing. And we're really using kind of our minds as much as our bodies, but people don't really see that one.
Yeah, no, that's awesome. And then on the outpatient side, I love what you said about kind of getting people back to their prior level of functions. So talk a little bit about
Yeah. So, a lot of people think, their first reaction of PT is, after surgery or something like that. And that's very much a part of our, a process. If you get a knee replacement or hip replacement or something with your shoulder, you're probably going to have to go to physical therapy.
Right.
But we also do conservative interventions, so kind of pre-op or postponing those surgical interventions if they are down the line. And sometimes we get patients that they think they're going to have surgery, but they get back to 100% without surgical interventions because they did conservative care. It's really about kind of finding those objective deficits and really catering a comprehensive treatment plan to that individual.
So talk about those conservative treatments for people at home. What are some of the times that might be appropriate?
Honestly, any type of orthopedic issue, so muscles, bones, joints, those kind of common aches and pains. The thing I tell patients is, it's better to be proactive than reactive, right? A lot of times we grit our teeth and we kind of just continue on and we let things linger and we let it smolder until it's like this big fire that we need to get something addressed. Whereas if we catch those orthopedic issues early, particularly things like knee pain, we can narrow down and find are you tight? Are you weak? Where are you tight? Where are you weak? Those sorts of things. Is it because you're sitting up out of a chair weird or doing stairs wrong?
Right.
And if we can kind of be corrective in that regard, we can definitely see positive change early. And so usually the earlier we get you, the quicker we can get them to go away.
So will always require a physician referral for something like that. Maybe somebody's sitting at home and they know, my back hurts all the time. Should they go to their doctor first or call you guys?
The awesome thing is that the majority of states, North Carolina included, have what we call direct access. So it is dependent on your insurance type.
Okay.
So if you have a commercial payer, your Blue Cross, your Cigna, your United, if it's a commercial insurance, they actually don't need a physician referral. Okay. They can come see us first, kind of cut through the weeds a little bit.
Right.
And then, we're really good at kind of diagnosing and knowing, all right, you will benefit from this, or we probably should, maybe investigate this a little further with your doctor. And we're always sending the plan of care. It's not like we're just on an island.
Right.
But if you have a federal payer like your TRICARES, your VAs, your Medicares, we do require a physician. Well, they require a physician's referral before you can be seen from us.
Okay, great. That's perfect information. And I think either path seems like a really straightforward way to get to you guys.
Honestly, yeah, and a lot of times, doctors, they're so inundated, right? They're so busy and they want their patients to get better. And if you call and you can't get in for a week or two, that's where that direct access is nice, because if they hear that, you rolled your ankle or, you hurt your shoulder, all right, I'll send the referral. Let's
go ahead and get that started. Yeah, that's perfect. So tell me, located on Main Street, how can people get in touch with you if they do have questions or want to schedule an appointment?
They can actually call our office at 910-721-3157. They talk to Jessica. Jessica's a great front office person. She'll kind of lead them down the path and kind of figure things out.
Great. Well, this has been very helpful. Thanks for joining us. We'll have to have you back soon to get more detailed on some other topics.
Definitely, yeah.
Good. Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics you'd like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novanthealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thank you again for joining us today. Be sure to join us next time for HealthWatch on AT&C TV.
This is ATMC TV, your community channel.